I'm Whitney Black, and I'm a sixth-year doctoral student in counseling psychology at the University of Kentucky. I've had numerous experiences to be involved in research over my graduate career. The first experience that comes to mind is my involvement over the last 6 years in the PRISM lab under the guidance of Dr. Rostowski and Dr. Riggle. We meet a couple times a month to create research projects, help each other out with existing research projects that we may be doing on our own. So the research requirements involved in the program, or even kind of dissertation work, we can provide support and guidance to one another in regards to those projects under their supervision. And also we've had several research projects that we've been able to create together and actually carry out from beginning to end, from kind of the development of a research idea and implementation of a project, and then finally writing up a publication together, which has been a wonderful experience. I've also held 2 years of research assistantship with Dr. Alicia Fedewa in the school psychology program, which was a wonderful experience of learning a little bit about implementing research in a school environment, kind of working with the community, and working with a research team that included undergraduate students. And then I've been able to collaborate across campus, which is something I've really enjoyed. So learning about multidisciplinary research that occurs in medicine, in health science, in gender and women's studies, that kind of add some variety to how I think about research beyond, I think, the focus and how it looks in counseling psychology. I feel I've received fantastic clinical training throughout my time in this program. I've had the opportunity to work in 2 university counseling centers, a long-term residential substance abuse treatment center for women, a federal medical center, and a family medical clinic. And I really enjoyed, as part of working in those different environments, being able to see the kind of work that psychologists do in different settings and get to kind of try on to see what might work for me professionally, in addition to developing a strong generalist clinical training. I think the strength of this program is the faculty, the staff, the students are all very supportive, which is really important when you're going through graduate training. I think anytime you have a hard day out at practicum, or you're feeling really drained, being able to go to class or go to a social event or reach out to your advisor or your peers and receive that support and a listening ear is really crucial. Learning how to be a counseling psychologist is really difficult. I think that when you are including so much personal growth and learning about yourself as a part of your clinical experiences, that it can be very draining and can be very challenging. And that social support is something that I don't know if I could have gotten through the program without it. So I think that that's our biggest strength. What I didn't know about graduate school and the process of getting a PhD in counseling psychology before I came was, I think, not a lot of information about all of the different steps of the process along the way, specifically that there was an internship at the end that might require us moving before we graduate. Luckily for me, that worked out that the move is actually going to be a positive thing for me and my family, but I think that was a little bit of a surprise coming in and realizing that at the end of the first year that was going to be, I guess, a hurdle before graduation. So I think that would be a good thing to know about.